Thank you for tuning in today. We're going to talk about deploying patient-centered virtual care with TELUS Health and BrightSquid. My name is Jeff McKay from BrightSquid. With me today are Teo Douglas from TELUS and Mark Eyre from BrightSquid. We'll go through a demonstration of how the system works, the secure mail communication into MedDialogue that allows you to securely communicate with your patients in an email-like way directly from your TELUS EMR. So we're going to talk about a few things. Starting, we're going to look at what a patient-centered virtual care system looks like. We'll also talk about how secure mail plays into the patient management role from a clinic's perspective. And we'll look at a couple sample workflows. Those will kind of be variable by clinic. They'll be variable by jurisdiction in terms of things like health service codes, different regulations with different colleges that you might be working with as well. We'll do a demonstration. Teo will take over to do sort of a demonstration, or exactly a demonstration, of what it looks like taking patient information from the patient record directly and sending that out to BrightSquid Secure Mail so that you can have that back and forth communication if need be with a patient, or even just a direct send of certain files like lab requisitions or any test results that you might want the patient to see. And then we'll look at what that looks like going through Secure Mail, how you interact with patients, how you get patients onto the system, and then putting stuff back into the patient record once it comes back. And we will address questions at the end that we have collected in advance. So there are really four components to a virtual care system. When virtual care became an urgent need for a lot of clinics, the natural thought is that we need to get video consults on the go. But we'll talk about sort of the distribution of the different types of technology, but really just one system is not enough. So the base or anchor of your virtual care system is your EMR. That's where your patient record is. That's the housing where the information is. You're going to need secure messaging to manage patient engagement asynchronously. So that's important because you don't need to have to align schedules anymore. So phone and video consults have that requirement that as much as you can have that communication happen outside of the confines of two or more schedules, it just makes the communication that much more simple. And that's why most of our communication in our personal lives is done through email and text messaging still. Phone is part of your virtual care system. A lot of virtual care can be conducted over the telephone. As well as virtual or video conferencing. So if you want to conduct a consultation where you can't be in the same physical location as a patient, but you do want to see them, and maybe you need to take a look at them visually, video is a great way for that to happen. That kind of escalates things above and beyond what the phone can do. So looking at how that's structured, when you read the research about this, and there is more and more research coming out about virtual care, secure mail, video conferencing, all that sort of thing. One of the leaders in this field is Kaiser Permanente in the U.S. When they look at 6.2 million, it's 36 million interactions done over telehealth. Over 80% of them, almost 83% of them, were done through secure messaging. So that's through patient portals, sending patients records, results, communication, patient requests coming in through secure messaging. And less than 0.5% of them are done by video, just to give you a sense of how clinics are really doing it and what works in practice. Most of what you're going to be doing as you set up your virtual care system and move forward with more virtual care in your practice is likely going to be secure messaging because, as I said, if you look at your day-to-day workflow personally from a patient perspective, most of how we interact with the world outside of our immediate proximity is done through text means. So what do you need to consider? It's not enough to just say, this service allows me to do video connections. Because we work in healthcare, there are different considerations that we need to take into account. Privacy, compliance, and security is the primary concern, obviously. So you need to make sure that any service you're working with is built compliant first, and you need to make sure that it's compliant in your jurisdiction. One of the issues that we work with in BrightSquid is that we do privacy consulting for clinics across Canada. And so a lot of clinics come to us with a new service they want to try or use. and it might not be compliant with PIPA or provincial legislation such as the Health Information Act in Alberta or FIPA in Ontario for different reasons. And there's a few considerations about that. You need to make sure that number one, it's compliant. You need to make sure that any vendor you're looking at isn't using data for third-party use, such as marketing or research for their own purposes, that sort of thing. All would fall out of compliance with privacy regulations in Canada. We also have to consider ease of use. And it's ease of use for physicians and staff and patients. Right? We do not need to add any more frustration to the lives of patients or physicians or staff, especially we don't want to contribute to physician burnout. We want to make things easy. So how can we come up with a platform? How can we use a platform that's easy for people to use? I think one of the reasons video consults account for such a small percentage of virtual care typically is that you get into more elderly populations and that stuff becomes inaccessible for a number of reasons, technology and hardware being one of them. Access, understanding for sure is one. I know when I'm unable to connect with my 78-year-old father on a regular video system that he's used to, we end up having to do a phone call that takes 5 or 10 minutes for me to walk him through how to use a different one, such as, if we can't get on FaceTime, for example, and we have to use Facebook video messaging, that gets difficult and cumbersome and frustrating for everybody involved. So we want to make sure it's easy and familiar. And we also want to look at clinical functionality. So a lot of systems that were jumped on immediately in healthcare, such as Zoom, which does have a healthcare version available, but it's still kind of basic Zoom, and it's really just the privacy that they've added. What features and functionality are there that are unique to the clinical use case? So medical clinics are not accounting offices. They're not shipping facilities. You shouldn't be looking at the same tools for communication that regular standard businesses are using because they're not built for your purposes in a clinic. So you want to look at services purpose-built for something in a clinic. Things to consider is, can I give a team access to my communication channel? Can I track individuals in the team who are accessing that team, things such as a clinic inbox? Can I recall messages that should no longer be available to certain recipients? So that's in the case of, oops, I sent a message to the wrong Jeff. I need to pull that back. Regular email does not always allow that, especially when you're dealing with different systems. If you're sending from Outlook to Gmail, for example, there's no real reason or way for a message in a Gmail account to be pulled back from Outlook. And read receipts as well. You want to have a system that's continuous, because once you send an email out of Outlook, for example, into Gmail, that data now belongs to Gmail. And a user that sent it would have to send a request through Outlook to Gmail to the end user who received that message to say, hey, I'd like to know if you looked at that message. And the user on the other end actually has to accept that and say, yeah, I'm okay with them knowing that I read this message. But you don't want to have to rely on that. You want to make sure that it just happens automatically. So looking at how SecureMail fits into patient management, from a product perspective, BrightSquid SecureMail is used as a virtual front desk. So there is team-based message management. We have a shared inbox that I'm sure Mark will demonstrate, that allows anybody assigned to have access to that inbox to manage patient incoming messages. And that works much like a telephone would in your clinic today. Mostly when people call into your clinic, the doctor doesn't pick up the phone. There's a number of staff members who answer the phone as they can or at a certain time of day, and they deal with the message appropriately. So you want to be able to maintain that team approach. Ease of use. So SecureMail doesn't require any installation of software. It's entirely web-based. Any device, a phone, a tablet, a laptop, a desktop computer that has internet access and web browser capabilities can access SecureMail from anywhere they have an internet connection. Now, some people might want to consider where they're accessing that information, but because it's text-based, it does give you that extra level of privacy, rather than potentially speaking on a phone on your office in a cubicle. Um, People aren't going to hear what you're typing or what you're reading on your screen, and convenience too. So again, going back to that idea of scheduling, we don't want to have to look for ways to align schedules and juggle schedules if we don't have to. If there's something that can be dealt with asynchronously, meaning we don't need to sync schedules together, it's easier for everyone. So if a patient at 9:30 at night is lying in bed and realizes, oh, I meant to call my clinic about my sore toe, they can send that message right then rather than, you know, go to sleep, wake up in the morning, forget, get to work, and at lunchtime at work, they're delaying their access to care. So as things occur to you, you can send a message. And same goes for the other way. If a physician or a clinic can respond when it's convenient for them. We have clinicians that either set aside time in their day or their week to address messages, or clinics that schedule time to review their inbox. Hey, we check our inbox when we get in at 8, we check our inbox at 10:30, and we check it at 3, just to make sure we can address any messages appropriately. Research does show patients prefer secure mail quite often to in-office visits when it's appropriate, as well as phone messages. And we know that clinicians and staff find secure mail to be a faster way to communicate than fax, then mail, and then phone as well. Because with fax, you don't know what's going to go through. I've talked to clinics that have a 50% fail rate on faxes going through just because the other end is so busy receiving faxes of their own and that the line is clogged. So there are ways around that, but we want to make sure that we're providing a secure channel that's not going to get blocked. So the virtual front desk is really set up to allow that triage of patient concerns coming in, as well as kind of put a bit of a wall between the patient and the clinician, that we can send messages back through the shared inbox from the clinician, so that clinicians aren't always getting pinged by a patient message necessarily. That doesn't typically happen. Patients are very respectful of physician time and availability using secure mail. But this allows a team-based approach, and as appropriate, potentially bringing one-to-one messages, and that's what we're going to look at a bit in the demo from a clinician perspective. Clinicians can send messages directly to patient, and you can actually configure the system to have any replies from the patient to go back through the shared inbox rather than going directly to the clinician, so we can address things in a timely manner. The first clinical workflow we'll look at is really just kind of the basic clinic flow. So there's a number of things that the virtual front desk can do for you. You send requests for care from a patient. Patient can, or the front desk team, whoever is on task at that time, can look at it and decide, hey, do we need a clinical assessment on this concern that's coming from the patient? If the answer is no, then that can just be addressed. Maybe the patient said, hey, I'd like an appointment. Then the front desk can manage that, respond, or with either respond through a message and say, I've booked you in for 2:30 this afternoon, or pick up the phone and call them and say, here are the appointment options that we have available. If there is some clinical decision required, then that message can just be forwarded to a physician. The physician can respond with advice as needed. In Alberta, some of that is billable potentially, and different provinces, depending on how that's set up, there's different ways to receive compensation for that. If a real-time investigation is required, do we need to see them over video? Can we talk to them on the phone, or do we need to bring them in for an appointment? Then the front desk can book the appointment, send any appropriate forms and questionnaires that might be required to help speed that process. We do know that clinics using secure mail for that process can save about 50% of appointment time just by getting prepped in advance, and that's allowed them to see as much as twice the number of patients every day. And then you can conduct the consult, again, virtual care, perhaps over video, phone, or in person. Respond to the patient afterwards with any follow-up. Here's our treatment plan that we came up with. Here's more information about your diagnosis, that sort of thing. Or, potentially, here's a lab rec, here's your prescription, all that sort of stuff. We can also use it to book specialist consultations as well. So across Canada, e-consultations are becoming more and more common. General practice might want to get a bit more of an expert opinion on a certain concern that a patient is presented with, forward that off. Hey, here's a question I have about this patient, and then the specialist can respond as well. So here's a quick sort of, in the case of an RX refill, depending on how you want to do that in your clinic, but a patient might just realize that they're out of their medication. They can send a quick notice to the clinic saying, hey, I need a refill. The front desk can look at that, review it. So there might be a standing order in place. They can carry it, or they forward on to the physician and say, hey, Mrs. Jones would like a refill, and the physician can address it appropriately. Review the request, look at any outstanding blood work perhaps, and address the issue directly through SecureMail. And you can see the different parts of our virtual care system that we're using here across the bottom. Basically, in this case, it's just SecureMail and your EMR the whole way across. For appointment management, there's lots of different ways to do appointment management with patients. But if a patient requests an appointment, it might be a routine request. They might need a questionnaire, so there's some back and forth with the virtual front desk beforehand. And then, that's all set up outside of the presence of the physician, obviously, as is standard. And then you might set up a visit. Again, maybe you're doing phone or video conference, and that allows the physician to, they can review the studies, they can do any kind of a remote examination they might need. Certain video conferencing systems allow file sharing, so, maybe the patient is having seizures, they might have a video of that. They can share that through that, or they can share something like that through SecureMail, or a photo of a rash or a cut or something. We do see a lot of that on the system as well. And then there's any follow-up that happens after the fact. It's all done through SecureMail and the EMR. So that takes us on to our demonstration. I'm just going to switch things over to Teo, so he can step in and show us what it looks like coming from the EMR into SecureMail. Teo, that should be in your hands now.
Perfect. Yep. Looks like it works. Okay, just confirming you can see my screen with net access.
Yep.
Okay, awesome. Jump into presentation mode. Okay, thanks so much, Jeff. So yeah, my name is Teo Douglas. I'm a product manager for our MedDialogue and eFax product on the TELUS Health side. So I'm excited to work with BrightSquid and show the integration between our TELUS EMR platforms and BrightSquid. A reminder that MedDialogue is integrated into all of our TELUS EMRs. So for today's demonstration, I'll be showing MedAccess. However, if you're a Wolf, PS Suite, or Kinlogix or Medisync customer, there is still the ability to do the same type of push of content from your EMR into BrightSquid and back using any of the TELUS EMRs, as they're all integrated to our MedDialogue network. If you have questions about MedDialogue, feel free to reach out to our teams, and we'd be happy to answer those. And again, in context today, we'll be looking at MedAccess. So for this part of the demo, what I'm showing here is I'm logged in as a test doctor who's working out of a Calgary clinic and is seeing a test patient today. Essentially, what we want to show is the ability to push data from my MedAccess EMR into the BrightSquid interface, and then be able to then further interact with patients and get that content across, as Jeff was mentioning. So in this example, I'm going to open up Test Sally's chart. And so once I go into Test Sally's chart, I'm going to create a new lab requisition. For this example, we're going to push across a lab requisition that will push to Sally for her to be able to take that requisition and have that filled. So in this example, I'll create my lab request. All right. So in MedAccess, this is a interface you're used to seeing. To create a MedDialogue message, we reuse the existing workflow in your MedAccess EMR that you're used to today, or any TELUS EMR platform that you're connected to. Essentially, you're following the same steps on the patient's chart of creating a new type of task specific to a lab request. We have the form on the screen here. You can see that a lot of the information is pre-populated from my test patient's data to avoid me having to write all this information in. I can check off any sort of tests that are needed on this and essentially package this up and push this through to the patient to then book the appointment and bring this paper to the lab. So in this example, again, I am the test doctor. I'm pushing this across to BrightSquid via MedDialogue. So I've selected BrightSquid as my destination of this form. And as a result, I'm now seeing this MedDialogue message piece, which essentially looks a lot like an Outlook email that you're used to seeing already. Essentially, I've got a to from a subject, which is pre-populated with the type of item that I've created. And then I can optionally add a text message in here if I wanted to make any sort of note. All these details would carry across into the BrightSquid interface on their side. In this example, because I'll be pushing this through to the patient, I'm not going to add any sort of message. I'll just push across this attachment so that the attachment can flow through to the BrightSquid inbox and through to the patient for printing that off and getting that across. So in this example, I'll hit send. I'm just getting a confirmation showing that I'm sending from myself to BrightSquid and just showing what content I'm sending. So as I click on send, what's happening behind the scenes right now is MedAccess is packaging up that form that I was looking at right here. I was looking at this just a moment ago. It's now packaged up that form and put that into a high quality, full resolution PDF document. One of the things that's great about this is that I'm sure a lot of clinicians are used to seeing really grainy or hard to read fax images that come across. And so with MedDialog, one of the key feature benefits that kind of comes with that is the fact that we can send across fully electronic data. So a PDF document like you would attach in your Outlook email comes across in the exact same quality on the other side. So full resolution, the text inside of it is selectable. If there was color on this PDF, that would come across. So MedDialog supports a wide array of different file formats to send across like you would in an email today. So at this point, that's essentially the end of what I would show within MedAccess. Again, I pushed this content from my MedAccess EMR to BrightSquid. So for the next piece of the demo, we will jump back to the BrightSquid interface and then essentially show how that content arrives in and how we'll push that across to the patient. Okay, so I'll stop there. Or is there anything else you guys want me to cover?
No, I think I'll pick up from here now, Teo. This is Mark Hare, Director of Customer Operations at BrightSquid, and I'll pick up the demo from this point on from the BrightSquid point of view. So I'm just going to start sharing my screen here now, and then momentarily you'll be seeing the BrightSquid interface on my side. So this is the BrightSquid interface from the same doctor's point of view. So from within BrightSquid Secure Mail, our users have the ability to communicate with others, whether those are other clinicians, or in this case, we're going to focus mainly on communicating with a patient. So a moment ago, when Teo was demonstrating from his screen, he sent this message over, pushed over this message called the lab general request. And if I open this message up, this is the PDF document that he pulled out of MedAccess and then attached to the outgoing communication. Now I can preview it here just to illustrate. This is that high resolution image. It's a little small on my screen right now because of my own resolution, but if I were to download this file, it would be a large, easy to read document. So I'm now going to forward this message on to my patient, who presumably will then be able to, well, I assume what they want to do with it, and that's what I'm going to show you, is that the patient can download this file, print it, and take it to their lab for whatever test needs to be done. So I'll click on forward here, and then we'll address it to our patient. Now I'm going to use this email address, which is a real email address. My goodness. .com. Now, as I type in the email address, I forgot the @ symbol. As I type in the email address, the system searches for a match to try to find this patient to see if they already are registered in the BrightSquid Secure Mail service. If they are not, then it's a simple matter for me to invite that person to become a Secure Mail user. So in this case, I'm inviting my patient, who has the awkward email address of testuser456@brightsquid.com. Now, I should point out that I'm using a brightsquid.com email address just because that's what I have access to. But make no mistake, this can be any email address in the universe. So Hotmail, Gmail, AOL, they're all fine. I'm using BrightSquid because that's what I have at my disposal. So we're going to send this message off to our patient. So I invite them. When I invite the patient, and I indicate that they are a patient, I'm asked to enter the patient's date of birth so we can use that as a verification of the patient's identity. Now, this patient's birthday is January 2nd, 1997, so January 2nd, 1997. So when the patient gets the email notification here in 1977, I misspoke. Oh, it is 97. When the patient gets the email in their inbox, they're going to get a regular old-fashioned email from the Bright Squid system that says, Dr. Squid has sent you a secure message. Click here to go and see it. Before they're able to view that message and download the information, we ask them to identify themselves via the skill test in question, which is, when's your birthday? That way we can prevent someone unauthorized accessing the information. So I'll go ahead and send that now. And so now what happens is that PDF document that was generated earlier is now uploaded to the Bright Squid Secure Mail server, and an email is sent to the patient's regular old-fashioned email inbox, letting them know that they've got a new message waiting for them in their Secure Mail in the Secure Mail account that they haven't quite created yet. So I'm going to now switch my point of view over to that of our patient. So I'll log out here and go over to my email inbox. And then waiting here in my Secure Mail inbox, let me see here. I got a couple of test messages. Sorry about that. There it is. So this is the email that I've actually received to my regular traditional email. So it says, Dr. Bright Squid at Bright Squid Test Practice has sent you an invitation to Secure Mail. If I open that message up, there's a little notification message that, for all intents and purposes, says, hey, I've sent you this new secure message. Click here to view the information that I've sent to you. You'll notice that there's no actual patient information in this email. It's just the notification. This is the non-secure message, to put another term to it. So the call to action is click here to view the message. So I'll go ahead and click there now. And now I'm asked to register and identify myself. So my name is Test Ellie. I'll create a password for my account. Now, I'm only going to have to do this one time. As a patient, once I create my account on Bright Squid Secure Mail, I can use it going forward. I don't have to register every single time. I'm actually creating my own account, which is why I'm selecting a password. And then the skill test in question, what's my date of birth? And I think I said it was January the 2nd, 1997. Now you'll notice that we force you to select the date of birth in these three boxes because it's less ambiguous that way. I, for one, have lived in Canada my whole life. When I see a date written as 02/03/1997, I don't really know if that's February 3rd or March the 2nd. So we use this less ambiguous way to identify the date of birth. Once I've entered all the appropriate information, I click register. I have to review the terms of use, which I'll do. And then when all that is taken care of and I click accept, waiting for me in my Secure Mail inbox is the message from my doctor's office. Now, the nuance of this is that the message was sent by the doctor, but from the patient's point of view, it was sent actually by the practice itself. Now, this becomes very valuable and very important in that, I think it was Jeffrey mentioned a few minutes ago, is that most patient messages that are coming back into your practice will be addressed through the virtual front desk, or what we often call the shared inbox. So in that way, our doctors and other clinicians are not going to be overwhelmed by incoming messages from patients. Instead, most of those messages will be managed by the MOA staff or the front desk staff in your different organizations. So from Sally's point of view now, I've now got this document, this PDF, that I can now download to my computer and then save and print it and then take it to my lab for whatever test I need to have done. So now that I've downloaded the full high-resolution file, here's all the information that I need. I'll just simply print this. I don't want to actually do this right now, but if I print it, it would just go to my printer. I get a piece of paper, and I head off to the lab for the tests that are being requested here. But if I go back now to Bright Squid, I can reply back to the practice and say, thanks, Doc, headed to the lab now. And then I send that response back. So that sort of closes the loop. So the practice now knows that I've received the information and I've headed to the lab to have the test done. If we were to switch back to Teo's point of view on the MedAccess side, we'd be able to see this response coming back, and then that would be added to the patient record and saved for, saved in the patient record for future reference if we ever need to refer back to this information. So I think that's everything that I wanted to show today. So I'm going to turn the screen broadcast back over to our original presenter, Jeff. All right. All right, Jeff, do you want to pick up there?
Thanks, Mark. I am now presenter, so let me just make sure we've got right screen here. Here we are back. So, did we get it? There we go. So that kind of takes us through the whole process of taking a message from your EMR through MedDialogue to SecureMail, allows you to have that interaction with patients. And one of the questions we get a lot is how many how do we record this information in the record? And, is there a record of all of this? And, you wouldn't record everything that comes through on a phone call from a patient. And in the same regard, you wouldn't record everything that a patient sends you via secure mail message. So you don't want to have that cluttering your patient record. You know what's appropriate and what's important to have in there. So you can easily cut and paste anything that doesn't get sent back. But as Mark said, hitting forward back to MedDialogue to your account, the information that's appended to the message once you send it out of MedDialogue to BrightSquid, that stays with the message. So even if you send it to a patient or forwarded it to another colleague, once it comes back to you, that patient information will always be connected to that, and you'll always be able to know who that patient is that's being discussed in that thread. And MedDialogue will recognize that as well and say, hey, this is this patient. This information goes to that patient record. So we have a complete record of that as appropriate. So you don't only forward anything that really needs to be there back to the patient record, and anything that's sort of a back and forth about more benign issues, you want to just kind of keep out of SecureMail. I do want to point out that right now SecureMail is free for any clinics in Canada that want to get signed up on the system during COVID-19 so that we can help maintain social distancing, address patient concerns as they're at home, perhaps in isolation, and still have that continuity of care going back and forth, because SecureMail does allow you to have that continuity, as we've seen, directly from your patient record to your clinician at your clinic as a patient. That's very important. So all you have to do is go to brightsquid.com, click on COVID-19 support for clinics, and you can request a free account. That'll go to Mark and his team, and they'll get you set up. We do have a couple more questions to address, and we'll just start. And I think this is probably targeted mostly towards Mark. What do we do, or what do clinics do, or what do we recommend when patients that won't accept a secure mail invite or that don't?
Well, I think the thing to remind everyone of is that, we use secure services because as the custodian, so the practice is the custodian of the medical health information, and we're obligated to use these secure services to meet the regulations. But more importantly, we do these things to protect our patients. It's not an academic exercise where we're just doing these things because they seem better. It's because we're obligated to do so from an ethical standpoint. So what I'll often advise my clients if they encounter a patient who doesn't want to use secure mail, at the end of the day, the patient has the right to see their information, and we provide this service as a tool to provide it to them in a way that's secure and compliant. If they are still stubborn and refuse to use the secure service, often the best recourse is to have them come in and pick it up, in person, which is less convenient and slower. But what we really don't want to do is switch over to the idea of, I'm just going to send it to you through a non-secure channel, because the patients don't really have the ability to sign away their rights. We're obligated to do everything we can to protect their information, and even if they tell you, I really want you just to email it to me, it's certainly not something that we would ever advise.
Yes, yeah, right, and yeah, exactly. And I think there's one sort of easy follow-up question for that, Mark, and I know we do deal with this quite often. What about patient populations such as elderly groups? Is that something? Because I talked about ease of use and access at the beginning. What about that?
Surprisingly, our demographics show that the average patient, average registered user on the patient side of BrightSquid Secure Mail, the average age is 58 years old. So a lot of our patients are into their 60s, 70s, even 80s and 90s. I had a support call with a lady this afternoon or this morning. She was 88 years old, and her only question to me was, how do I reset my password? She had no problem logging in and using the service. I was surprised when we started reaching out to patients a couple of years ago. We expected that our typical demographic would be your millennials, if you will, the folks in their 20s and 30s. But as it turned out, the caregivers in most families are the moms, and they're often in their 40s and 50s and beyond. So contrary to what most of us expected, we're seeing a lot of female users in their later years.
Yeah, well, and that's interesting. If you look at the age chart, the curve is a pretty normal bell curve in terms of who uses it. And I think this next question is for both of you, Mark and Teo. Can my staff use MedDialogue and SecureMail on my behalf as a clinician?
I'll let Teo answer first, and then I'll add in if there's some additional information that's relevant to BrightSquid.
Yeah, sounds good. So from the TELUS side, MedDialogue, we typically would enable for the practitioners in your clinic. So things like, or roles like physicians, nurse practitioners, any sort of allied health professionals would typically be registered and on the network for MedDialogue. However, all staff in the clinic do have the ability to send and receive MedDialogue messages on behalf of those users who are registered. So if you're an MOA or a receptionist at the clinic and you work for Dr. Smith, you have the ability in your EMR to access Dr. Smith's MedDialogue messages and send out messages on Dr. Smith's behalf based on your EMR permissions and the settings on that side. So yes, absolutely anyone at the clinic has the ability to push content to BrightSquid using MedDialogue.
And then BrightSquid works under a similar principle. We have the shared inbox, which I talked about during my demonstration, that everyone within the clinic can have access to. So that's how we can share information amongst multiple users. So we don't necessarily have to share logins and passwords. Any message that comes into the shared inbox, people can log in as themselves, access that information, and then act upon that information, either by replying or forwarding it to somebody else.
And yeah, and that's great. And I think, Mark, maybe kind of a follow-up to that. Can you just address the issue or the process of registering your clinic with SecureMail and how that's relevant to your MedDialogue usage?
Yeah, certainly. So, in the demonstration that I showed, I illustrated the process by which a practice would invite a patient. The similar practice exists for an existing practice to invite a new practice, someone who doesn't have a SecureMail account. So in much the same way we invited our test patient, I could invite, as a subscriber, I could invite another clinic to register their own SecureMail account. So if I need to forward a message to another doctor or a lab or some other allied health professional, I'd follow the exact same process. I'd use that practice's email address, and then that person would be invited to register themselves as an individual, and they would create their practice or their organizational structure at the same time. So Jeff, if I was to invite you, you'd get an email to jeff@gmail.com or whatever your address is. And as you signed up, you would enter the name of your practice, so Jeff Medical, and your name, Jeff McKay, would become the user. So you'd be creating two entities, both as a practice and an individual. Once that SecureMail account is established and ready to go, then optionally you could connect that to the MedDialogue network and become another member of that community.
Great. Yeah, perfect. So that wraps up our questions for the day. I don't know, Mark and Teo, do you have anything else you wanted to add for our listeners before we wrap up?
Just one thing to highlight from the TELUS side. Just a reminder with MedDialogue that any sort of content you have in your EMR can be pushed to BrightSquid. So in that example, we used a lab request to push that across to the patient. But if there are other types of documents, let's say, like a patient sick note or something else, any sort of content from your EMR can be pushed out. MedDialogue is integrated in all different parts of your EMR in different areas, so that regardless of what type of content you're creating, you can push it to BrightSquid using MedDialogue. And then likewise, on the receiving side, any sort of content can also come back. So if you complete that patient messaging correspondence within BrightSquid, you can optionally push that content back to your EMR and have that automatically come in and store and attach directly to the patient chart. Without your support staff having to look up that patient, look at the document, and assign it to the right person. Again, because this is an electronic, secure connection between the two systems, we can pass along, that patient information to match that in your system. on your EMR. So very integrated and automated to be able to push that content and have that store in your EMR as the long-term kind of house or storage for that information. So just wanted to highlight that as that comes up a lot as well.
Yeah, I think that's actually a great point to build on with the idea that what SecureMail does in that standpoint with the integration with MedDialog, you have this unified digital channel, right? You have this digital connection out of your EMR that's your source of truth, and any information you need to get to your patients. Now right now we're using an EMR and we're using phone, and they're disconnected. Where sometimes we're using mail in that as well. Clinics that use SecureMail and MedDialog with that smooth sort of digital workflow, we're not printing stuff off. Our workflows in that sense are more streamlined. And clinics actually see greater staff satisfaction, which leads to actually higher retention rates. And we've talked to clinics who have measured that. They've seen a reduction in phone traffic by 30% or more, and they've actually attributed that drop and the implementation of SecureMail with the easier workflows, with a increase in staff retention because people are more satisfied with their job because it's easier, it's less frantic. They're not jumping from one means of communication to another and trying to connect all those disconnected systems, where we've got this now nicely connected stream of flow of information from the clinician and the clinic through the EMR and SecureMail to the patient and back again, so you have that really nice closed loop. Mark, is there anything else you wanted to add to that?
Sorry, I was on mute. No, I think I'm happy. So carry on.
Perfect. Well, thank you for tuning in and having a listen to our webinar. Again, if you have any questions, I know the MedDialog team is very well versed in how this all works. So contact your TELUS representatives, and also SecureMail, the support team. We've been working with clinics for about 10 years on this, so you can't find a use case that we haven't worked out. So please get in touch if you have any further questions.